1. A CNA instructor is planning a training session on infection control for adult learners. Which strategy best aligns with adult learning theory? A. Requiring memorization of infection control terms. B. Providing hands-on practice with PP in realistic scenarios. C. Assigning textbook chapters for independent reading. D. Conducting multiple-choice quizzes before instruction. 2. During clinical instruction, a student consistently struggles with proper hand hygiene technique. What should the instructor do first? A. Remove the student from clinical placement. B. Provide written feedback for later review. C. Offer immediate demonstration and corrective coaching. D. Notify the training program director. 3. An effective curriculum for CNA trainees should include which of the following elements? A. Weekly quizzes with subjective scoring. B. Topics selected solely by the instructor's preference. C. Clearly defined learning objectives aligned with state competencies. D. Informal lectures without documentation. 4. Which approach most effectively evaluates a CNA student's clinical performance? A. Peer-reviewed evaluations. B. Self-assessment surveys. C. Objective checklists based on specific competencies. D. Oral exams without observation. 5. A new instructor wants to incorporate feedback from students. According to best practices, feedback should be A. General and infrequent. B. Only given at the end of training. C. Specific, timely, and constructive. D. Delivered in group settings only. 6. When designing training for adult learners, which principle is most important? A. Learning is best when material is abstract and theoretical. B. Adults prefer to be passive recipients of information. C. Adults need to see the relevance of what they are learning. D. Instructor-led lectures should dominate the schedule. 7. A CNA instructor observes that a student has not documented vital signs correctly. What is the best action? A. Ignore the mistake if the outcome was not affected. B. Mark the student as failed immediately. C. Provide immediate correction and schedule additional practice. D. Let another student handle documentation going forward. 8. When evaluating the effectiveness of a CNA curriculum, the most reliable indicator is A. Student satisfaction surveys. B. Completion rates of training modules. C. Competency outcomes based on state-approved standards. D. Number of training hours delivered. 9. A key legal responsibility of a CNA instructor is to A. Permit students to make minor clinical errors to foster independence. B. Keep personal notes on student behavior without sharing them. C. Ensure that clinical training complies with regulatory standards. D. Allow flexibility in skills checklists to accommodate student preference. 10. Which method best supports the development of clinical judgment in CNA trainees? A. True-false quizzes after each lecture. B. Role-play simulations of patient care scenarios. C. Group projects unrelated to clinical content. D. Watching pre-recorded videos without discussion. 11. An instructor is creating a unit on communication in healthcare. To promote skill mastery, the instructor should A. Require rote memorization of communication models. B. Use scripted role-plays followed by reflective feedback. C. Focus on written communication only. D. Avoid scenario-based learning to reduce time. 12. During a performance evaluation, a student disputes a low rating on infection control. What is the instructor's best course of action? A. Change the score to maintain morale. B. Ignore the complaint and move on. C. Review the evaluation rubric with the student and discuss observations. D. Ask another student to validate the score. 13. Which documentation practice is required for regulatory compliance in a CNA program? A. Keeping records only until the student passes the exam. B. Using personal notes instead of official forms. C. Maintaining student skill checklists and clinical evaluations. D. Allowing students to self-document progress. 14. A CNA instructor wants to mentor a new colleague. What approach demonstrates effective mentoring? A. Assigning them to independent tasks only. B. Allowing them to observe but not participate. C. Providing support, modeling instruction, and offering feedback. D. Waiting for the colleague to ask for help. 15. What distinguishes adult learners from traditional high school students in a CNA training context? A. Adults learn faster and require less repetition. B. Adults are generally uninterested in application. C. Adults bring prior experience that informs their learning. D. Adults prefer unstructured learning environments. 16. A student is underperforming due to language barriers. Which instructional strategy is most appropriate? A. Remove the student from the program. B. Continue without accommodations. C. Use simplified language and visual aids. D. Assign more written work. 17. To ensure fairness during evaluations, the CNA instructor should A. Allow students to grade each other. B. Use subjective measures of attitude. C. Apply standardized rubrics consistently across students. D. Grade based on personal impressions. 18. During a skills demonstration, a student forgets a step. The instructor should A. Fail the student immediately. B. Allow the student to finish, then review the step and reassess. C. Stop the demo and restart the evaluation. D. Ask another student to assist. 19. What is the primary goal of a train-the-trainer program for CNA instructors? A. To evaluate facility staff. B. To prepare instructors to teach and evaluate CNA students in compliance with state guidelines. C. To allow CNAs to become RNs. D. To develop billing procedures. 20. An instructor delivers feedback that is too vague. What is the likely outcome? A. Increased motivation in students. B. Clear understanding of expectations. C. Student confusion and lack of improvement. D. Improved test scores. 21. Which of the following best demonstrates adherence to legal and ethical training practices? A. Allowing undocumented hours to be counted if the student was present. B. Using subjective scoring tools for clinicals. C. Failing students who report unsafe conditions. D. Reporting and remediating unsafe practices promptly. 22. A CNA instructor should keep training documentation for A. As long as the student is enrolled. B. 1 month after course completion. C. The period mandated by the state regulatory body. D. Until the instructor leaves the position. 23. In evaluating instructional effectiveness, which data is most useful? A. Instructor attendance logs. B. Number of handouts distributed. C. Student competency achievement rates. D. Time taken to complete assignments. 24. A new instructor asks how to handle disruptive students during clinical. The most appropriate response is A. Ignore disruptions to avoid confrontation. B. Remove the student without discussion. C. Address the behavior privately and reinforce expectations. D. Let the facility staff handle it. 25. Which of the following is essential when creating a CNA training curriculum? A. Instructor preferences. B. National guidelines only. C. State-specific regulatory requirements. D. Popular textbook chapters. 26. What is a common barrier to adult learning in CNA programs? A. Excessive hands-on practice. B. Lack of real-life relevance. C. Too many discussions. D. Frequent quizzes. 27. When mentoring a new instructor, what is the best way to support skill development? A. Assigning only clerical tasks. B. Shadowing without engagement. C. Providing coaching, observation opportunities, and feedback. D. Avoiding critique to build confidence. 28. Which of the following best aligns with adult learning theory? A. Mandatory daily quizzes with no feedback. B. Lectures that do not permit questions. C. Learning that builds on prior experiences and encourages problem solving. D. Repetition of content without application. 29. What is the main reason for maintaining detailed student evaluation records? A. To justify instructor pay. B. For entertainment. C. For compliance, accountability, and student progress tracking. D. To reduce classroom time. 30. A student expresses confusion over the instructor's feedback. What should the instructor do? A. Refer the student to the textbook. B. Clarify the feedback using specific examples. C. Tell the student to try harder. D. Ignore the concern. 31. A CNA instructor observes a student applying a soiled glove during a sterile procedure. What is the most appropriate response? A. Ignore it since the glove was worn. B. Instruct the student to continue and correct later. C. Stop the procedure and review sterile technique immediately. D. Let another student demonstrate the skill. 32. A clinical evaluation tool must be A. Subjective and adaptable. B. Based on student preferences. C. Objective, measurable, and aligned with training goals. D. Optional for experienced students. 33. When planning a CNA course, what should the instructor do first? A. Schedule exams. B. Choose a textbook. C. Review state-mandated competency requirements. D. Design field trips. 34. An adult learner expresses reluctance to participate in group activities. The best instructional response is to A. Ignore the student's concerns. B. Remove them from the course. C. Offer alternative, individualized learning methods. D. Reduce course requirements. 35. A student accuses a CNA instructor of unfair grading. The instructor should A. Tell the student grading is final. B. Avoid reviewing the score. C. Refer to the evaluation rubric and discuss the performance. D. Ask other students for input. 36. The most important reason to use skill checklists in CNA training is A. To meet accreditation requirements. B. To reduce instructor workload. C. To ensure consistent evaluation of required competencies. D. To simplify grading for instructors. 37. Which of the following actions can best improve a CNA instructor's feedback skills? A. Avoid difficult conversations. B. Practice giving feedback using specific, behavior-focused language. C. Focus on general praise. D. Deliver feedback only at the end of training. 38. In the context of legal accountability, the CNA instructor must A. Grade based on personal judgment. B. Ensure documentation of student performance is accurate and current. C. Allow flexibility in attendance tracking. D. Permit students to complete assignments late without penalties. 39. In a train-the-trainer program, the role of instructional design is to A. Encourage spontaneous teaching styles. B. Eliminate the need for rubrics. C. Structure learning activities around measurable objectives. D. Focus solely on testing methods. 40. During mentoring, what is the best method to help new instructors learn to manage classroom behavior? A. Give them full responsibility immediately. B. Let them shadow without comment. C. Discuss scenarios, co-teach, and debrief after sessions. D. Avoid discipline discussions. 41. How can a CNA instructor promote self-reflection among adult learners? A. Give only numerical scores. B. Discourage journaling. C. Encourage learners to set goals and assess their own progress. D. Limit discussion of past experiences. 42. What is the most effective way to deliver constructive feedback in clinical settings? A. In public, for full impact. B. Immediately, privately, and focused on behavior. C. Through email only. D. By peer review only. 43. An instructor adjusts the teaching plan based on real-time student feedback. This demonstrates A. Poor planning. B. Lack of control. C. Responsive and flexible instruction. D. Inconsistent delivery. 44. An evaluation method that includes instructor observation, student self-assessment, and peer feedback is an example of A. Summative assessment. B. Holistic evaluation. C. Minimal grading. D. Instructor bias. 45. When a CNA student makes a clinical error, the instructor should A. Ignore the error if no one was harmed. B. Publicly reprimand the student. C. Use it as a teaching moment with immediate debrief. D. Let the facility staff address it. 46. In curriculum development, what is a key component of instructional alignment? A. Matching course activities with program outcomes and assessments. B. Scheduling content around instructor availability. C. Selecting topics based on current trends. D. Avoiding standardized guidelines. 47. Instructors are legally required to ensure A. All students pass the course. B. Students are tested equally, regardless of competency. C. All evaluations are objective, documented, and based on approved standards. D. No student ever receives a failing grade. 48. Which strategy best addresses diverse learning styles in a CNA class? A. Using only lecture and note-taking. B. Offering written, visual, and kinesthetic activities. C. Mandating one way to complete assignments. D. Minimizing hands-on practice. 49. A CNA student questions the necessity of documenting fluid intake. How should the instructor respond? A. Ignore the question. B. State because it's required. C. Explain how fluid tracking impacts patient safety and outcomes. D. Tell them to review the textbook. 50. Which of the following is a best practice in documenting student skills competency? A. Document only final pass-fail. B. Use anecdotal notes exclusively. C. Complete checklist ratings during or immediately after the demonstration. D. Let students document their own progress. 51. In a classroom discussion, an adult learner dominates the conversation. The instructor should A. Allow it to continue. B. Ignore other students. C. Set participation expectations and manage speaking time equitably. D. Remove the student from the discussion. 52. A mentor notices a new instructor giving unclear instructions. The best mentoring technique is to A. Ignore it to avoid conflict. B. Take over the class. C. Offer targeted suggestions and model effective communication. D. Report them to administration. 53. CNA instructors must stay current on regulations to A. Avoid unnecessary paperwork. B. Ensure their own credentials remain valid. C. Provide accurate instruction and maintain compliance. D. Reduce teaching time. 54. Which is the most appropriate method for documenting student clinical errors? A. Email the student. B. Make a note for personal use only. C. Record in the student's clinical evaluation log with factual descriptions. D. Discuss verbally with no record. 55. A well-designed skills lab should prioritize A. Cost efficiency. B. Theory instruction only. C. Realistic practice using standard equipment and scenarios. D. Limiting access to high performers. 56. Adult learners are most motivated when A. They are told what to do without explanation. B. They understand the relevance of the content to their goals. C. They work in isolation. D. Assessment is withheld until the end. 57. What should a CNA instructor do if they suspect a student is falsifying clinical documentation? A. Ignore it unless it happens again. B. Quietly mention it to classmates. C. Follow institutional protocol and document the concern. D. Handle it privately with no documentation. 58. When co-teaching with a new instructor, the lead instructor should A. Allow the new instructor to lead with no oversight. B. Provide no feedback to maintain authority. C. Plan collaboratively and provide real-time support. D. Grade their work as a student. 59. How can CNA instructors ensure curriculum remains aligned with current practices? A. Use the same material every year. B. Avoid updates unless mandated. C. Review regulatory changes and evidence-based practice regularly. D. Focus on instructor convenience. 60. What is the purpose of formative assessment in CNA training? A. To assign final grades. B. To compare students. C. To provide feedback that improves learning during instruction. D. To increase paperwork. 61. Which strategy is most appropriate when teaching psychomotor skills to CNA students? A. Providing written instructions only. B. Showing a demonstration, followed by guided student practice. C. Conducting a group discussion without practice. D. Letting students learn the skill independently. 62. A CNA instructor is revising the core syllabus. Which item is essential for inclusion? A. Instructor's vacation schedule. B. Daily student journaling requirements. C. Course objectives aligned with state CNA competencies. D. Optional learning resources only. 63. How can an instructor best support a student struggling with clinical confidence? A. Criticize errors to build toughness. B. Allow the student to sit out of skills. C. Provide structured practice with positive reinforcement. D. Avoid giving feedback to reduce anxiety. 64. A student makes an error during a clinical skill demonstration. What is the instructor's primary responsibility? A. Punish the student for the error. B. Immediately correct the student and ensure client safety. C. Let the student finish before intervening. D. Wait until the end of class to address it. 65. A CNA instructor gives unclear instructions before a skill lab. What outcome is likely? A. Students will improvise correctly. B. Learning outcomes will improve. C. Students may perform the skill incorrectly or unsafely. D. Students will ask fewer questions. 66. What should be included in student training records for regulatory compliance? A. Student reflections. B. Clinical anecdotes. C. Skills checklists and attendance logs. D. Group project evaluations. 67. Which is a common adult learning barrier that instructors must address? A. Overuse of interactive materials. B. High motivation levels. C. Work-life balance challenges affecting attendance. D. Too much clinical time. 68. When evaluating new curriculum material, a CNA instructor should ensure it A. Is popular among other schools. B. Includes trendy healthcare terminology. C. Aligns with approved competencies and reflects best practice. D. Requires minimal instructor involvement. 69. What is the instructor's role when students are performing a high-risk clinical skill? A. Observe passively. B. Leave students unsupervised. C. Provide close supervision and ensure safety protocols. D. Focus on paperwork during procedures. 70. A CNA instructor is evaluating a new instructor's teaching. Which method provides the best feedback? A. General praise after class. B. Private, structured debrief with specific observations. C. Group discussion with students. D. Public feedback during the lesson. 71. In a train-the-trainer program, instructors learn to A. Supervise CNAs in hospitals. B. Deliver and evaluate CNA educational programs within regulatory frameworks. C. Manage unit budgets. D. Recruit students into advanced nursing roles. 72. What documentation is essential during skills testing? A. Instructor opinions. B. Student preferences. C. Performance checklists with date, time, and evaluator signature. D. Daily instructor journals. 73. Which of the following is a legal risk for a CNA instructor? A. Creating a strict testing schedule. B. Failing to address a student's unsafe practice. C. Expecting professionalism from students. D. Asking students to evaluate the course. 74. To facilitate peer learning, a CNA instructor could A. Assign students to observe and critique each other using evaluation tools. B. Avoid peer interaction. C. Let students teach new skills without supervision. D. Focus on solo work only. 75. When preparing adult learners for certification exams, instructors should A. Focus on memorization only. B. Use a variety of strategies including review sessions, practice tests, and scenarios. C. Skip feedback to reduce pressure. D. Avoid discussing test expectations. 76. Which behavior demonstrates effective professional communication by a CNA instructor? A. Criticizing students in front of clients. B. Giving unclear, rushed instructions. C. Using respectful, direct feedback tailored to the learner. D. Avoiding questions to maintain control. 77. A student reports a potentially unsafe clinical assignment. The instructor's first step is to A. Dismiss the report as exaggerated. B. Notify administration and assess the situation. C. Tell the student to proceed anyway. D. Remove the student from the course. 78. During a simulation, a student becomes emotionally overwhelmed. The instructor should A. Force the student to continue. B. Dismiss their concerns. C. Pause the simulation and offer support or debriefing. D. Ignore the behavior. 79. What is one advantage of scenario-based learning in CNA training? A. It reduces need for evaluations. B. It allows instructors to cover more topics in less time. C. It helps students apply knowledge to real-life situations. D. It limits opportunities for feedback. 80. A CNA instructor should align each lesson plan with A. Personal teaching preferences. B. Available classroom materials. C. Stated objectives and required competencies. D. Peer instructor methods. 81. Which of the following best promotes accountability in CNA students? A. Optional assignments. B. Requiring completion of skill checklists with instructor verification. C. Relying on self-assessment only. D. Allowing students to work unsupervised. 82. When providing feedback to adult learners, instructors should avoid A. Specific examples. B. Respectful tone. C. Public humiliation. D. Constructive suggestions. 83. Which of the following represents unethical behavior by a CNA instructor? A. Offering tutoring support to struggling students. B. Testing students before all content is delivered. C. Falsifying attendance to help a student pass. D. Requiring students to attend clinical orientation. 84. In mentoring, which strategy helps the new instructor develop confidence? A. Frequent criticism. B. Assigning administrative tasks only. C. Providing encouragement and modeling best practices. D. Keeping them from interacting with students. 85. What strategy supports adult learners in transferring classroom learning to clinical practice? A. Strict lecture-only format. B. Practical application in simulated and real settings. C. Group projects unrelated to clinical care. D. Delayed practice after instruction. 86. How should an instructor document student progress for skill remediation? A. General notes with no dates. B. Comments without evaluator initials. C. Detailed, dated notes on progress and additional instruction. D. Student comments only. 87. When designing instructional materials for adults, an instructor should A. Use academic language and theory. B. Avoid including outcomes. C. Consider relevance, clarity, and application. D. Focus on instructor interest. 88. A student refuses to follow standard precautions during clinical. The instructor must A. Allow it if no one complains. B. Document the incident and follow disciplinary protocol. C. Assign extra homework. D. Ignore the behavior. 89. Which of the following is a primary benefit of using rubrics in clinical evaluation? A. Reduces paperwork. B. Allows flexible interpretation. C. Promotes consistent, objective scoring. D. Replaces instructor observation. 90. How should a CNA instructor prepare students for diverse patient care scenarios? A. Avoid discussing difficult cases. B. Focus only on common situations. C. Include varied case studies and simulations in training. D. Let clinical sites handle diversity issues. 91. During a classroom session, a CNA student shares incorrect medical information. The instructor should A. Ignore it to avoid embarrassment. B. Agree to maintain class harmony. C. Correct the misinformation respectfully and provide accurate content. D. Ask the class to vote on the correct answer. 92. A CNA instructor identifies a trend of poor performance in vital sign assessment. What should be the first step? A. Increase written testing. B. Replace all students. C. Reassess instructional methods and provide targeted remediation. D. Decrease lab time. 93. What is the most effective method for evaluating psychomotor skills? A. Multiple choice testing. B. Peer review alone. C. Direct observation with performance checklists. D. Self-reporting. 94. Which strategy is most effective in promoting critical thinking in CNA students? A. Memorization drills. B. Scenario-based questions and case analysis. C. Instructor lectures only. D. Open book quizzes. 95. When mentoring a new CNA instructor, what is a sign of instructional growth? A. Reduced communication with students. B. Dependence on lecture format. C. Use of varied teaching strategies and student-centered methods. D. Avoidance of feedback. 96. What is a key benefit of debriefing after a simulation activity? A. It increases paperwork. B. It reinforces learning and encourages reflection. C. It shortens class time. D. It replaces written exams. 97. A CNA instructor must adapt training content when A. Students request changes. B. State regulations are updated. C. The instructor prefers a new textbook. D. Clinical partners change. 98. Which communication approach best supports adult learners? A. Formal, distant tone. B. One-way instruction. C. Open, respectful dialogue with clarification opportunities. D. Limiting questions. 99. A student repeatedly performs poor hand hygiene. The instructor should A. Fail the student immediately. B. Ignore the behavior. C. Provide remedial instruction and reassess skills. D. Ask peers to correct it. 100. A CNA instructor uses anonymous student surveys to gather course feedback. This supports A. Instructor entertainment. B. Learner engagement and quality improvement. C. Elimination of grading standards. D. Student-led curriculum. 101. A new curriculum is being piloted. What role should the CNA instructor play? A. Act as a passive observer. B. Resist any changes. C. Actively provide feedback on effectiveness and outcomes. D. Delay implementation until next term. 102. What is the instructor's responsibility during off-site clinical rotations? A. Leave student supervision to facility staff. B. Observe from a distance without documentation. C. Actively monitor student activities and ensure compliance with objectives. D. Focus only on paperwork. 103. The effectiveness of clinical instruction is best assessed by A. Student surveys only. B. Number of pass-fail grades. C. Observe student performance against competency standards. D. Completion of reading assignments. 104. A CNA instructor assigns a reflective journal. This strategy supports A. Memorization. B. Self-awareness and integration of experience. C. Grading simplicity. D. Objective skill evaluation. 105. What is one way to manage large CNA class sizes effectively? A. Cancel clinical rotations. B. Reduce instructor oversight. C. Utilize structured lab rotations and assistant instructors. D. Eliminate one-on-one feedback. 106. An instructor must provide a student with remediation. What should be documented? A. Verbal comments only. B. Remediation plan, progress, and outcomes. C. Peer observations. D. Instructor preferences. 107. A CNA instructor should approach lesson planning by A. Replicating the last instructor's method exactly. B. Focusing only on skills. C. Aligning objectives, activities, and assessments. D. Avoiding structured time frames. 108. Which of the following requires immediate documentation? A. Informal classroom discussion. B. A student refusal to complete an assigned clinical task. C. Student opinion about textbooks. D. Absence from one lecture. 109. What is the role of learning objectives in a CNA course? A. They are optional suggestions. B. They guide teaching and provide criteria for assessment. C. They replace evaluation rubrics. D. They are only for student reference. 110. Which strategy supports ethical decision-making during clinical instruction? A. Encourage students to rely on peers for answers. B. Ignore minor documentation errors. C. Discuss dilemmas using the code of ethics and real examples. D. Let students create their own policies. 111. A CNA student reports harassment during clinical. The instructor must A. Delay the response to gather more stories. B. Refer the student to a peer. C. Follow institutional reporting protocols immediately. D. Tell the student to ignore it. 112. What best describes an effective preclinical conference? A. A social meetup. B. A review of student attire only. C. Orientation to learning goals, procedures, and responsibilities. D. A discussion of student grievances. 113. Which of the following methods best improves CNA student retention of skills? A. Lecture-only delivery. B. Scheduled review and reinforcement of core procedures. C. Relying on textbook readings. D. High-stakes final exams only. 114. An effective method to ensure objectivity in grading is to A. Grade based on overall impression. B. Use consistent rubrics and checklists. C. Allow students to self-grade. D. Grade on a curve. 115. What is the best way to handle student conflict during group work? A. Ignore it. B. Let students resolve it without support. C. Mediate and promote professional communication and roles. D. Disband the group. 116. During documentation review, a student's entries are incomplete. The instructor should A. Accept them if the skill was demonstrated. B. Tell the student to improve without further action. C. Provide feedback and require correction. D. Penalize the entire group. 117. Which of the following best defines competency-based education in CNA training? A. Progress based on time spent in training. B. Students advancing only when they demonstrate mastery. C. Pass-fail grading only. D. A focus on participation. 118. What role does feedback play in the evaluation process? A. It discourages learning. B. It supports continuous improvement and guides development. C. It replaces assessments. D. It is optional in clinical settings. 119. The primary legal responsibility of the CNA instructor is to A. Entertain students. B. Ensure content is enjoyable. C. Teach, supervise, and evaluate within regulatory standards. D. Recruit new enrollees. 120. In a train-the-trainer setting, what is the main purpose of practicum teaching? A. Evaluate textbooks. B. Practice administrative tasks. C. Apply instructional theory to real teaching environments. D. Take final exams. Camp CNA School Health Aide. The Camp CNA School Health Aide Test is a specialized certification assessment designed to evaluate the knowledge, instructional competency, and regulatory understanding of individuals preparing to serve as certified nurse assistant CNA instructors or health aides in camp or school-based settings. This exam focuses on key areas such as adult learning principles, curriculum planning, clinical supervision, student evaluation, legal compliance, communication, and mentoring techniques. Candidates must demonstrate the ability to effectively train and guide CNA students, uphold safety and ethical standards, and maintain accurate records in educational and clinical environments. The test ensures that instructors are fully prepared to deliver high-quality, compliant healthcare training in youth-oriented or academic contexts. Here are the top 5 beneficial uses of the sample exam. 1. Instructor certification. The Camp CNA School Health Aide Test certifies professionals to train CNAs or health aides in educational and camp-based settings, ensuring they meet state and institutional standards. 2. Quality of care and instruction. It promotes high-quality, standardized training practices by verifying the instructor's knowledge in clinical supervision, communication, and curriculum development. 3. Regulatory compliance. Passing the test demonstrates understanding of legal responsibilities, documentation, and ethical conduct, critical for maintaining compliance with healthcare education regulations. 4. Student safety and learning outcomes. Certified instructors are better equipped to teach safe practices and enhance student learning, especially in vulnerable youth environments. 5. Career advancement. Earning this certification opens opportunities for leadership roles in training, education, and camp health aide coordination.